The prayer and joy of every pregnant woman is to safely deliver their baby. But one of the things that could stand in the way from this happening is preeclampsia. Good day, everyone. My name is Pharmacist Cav, and today on Pharmacist Cav TV, we have a medical doctor and an expecting mother to dissect and teach us what preeclampsia is all about. Please, doctor, can you introduce yourself?
Sure. My name is Dr. Mrs. Moka Kelechiku Helen. You can call me Dr. K.
Oh, Dr. K.
Yeah.
Dr. K, you're welcome and thank you for honoring our invitation.
Thank you.
So let's not waste much time. Let's dive straight into the business of the day. So, doctor, please, what is preeclampsia?
Okay. Preeclampsia is one of the complications that can arise in pregnancy. It's a multi-systemic disease, so it can affect all systems. And it's usually when a pregnant woman comes down with hypertension and protein in urine
Okay.
after 20 weeks of gestation.
Okay.
And this woman was previously normotensive and normoproteinuric. That means she was not hypertensive before then and she wasn't having protein in her urine before then.
Okay. Okay. So, will I be wrong by saying that preeclampsia is pregnancy? Sorry, is hypertension in pregnancy?
No, you'll be wrong because they are two different things. Hypertension in pregnancy is just a woman having an elevated blood pressure in pregnancy, and it can occur before 20 weeks.
Okay.
Yeah, you can have chronic hypertension in pregnancy where a woman that was previously hypertensive becomes pregnant and
Oh.
she's still hypertensive. Then you
Okay.
can have gestational hypertension, which
Okay.
is still diagnosed after 20 weeks. But it's
Okay.
just an elevated blood pressure in
Okay.
pregnancy, no protein in urine. It becomes preeclampsia when there's hypertension and then there's protein in urine.
Okay. Okay. Wow. Wow. Thank you very much. I'm just being schooled by Dr. K. Thank you very much for that explanation. So sometimes I hear preeclampsia and I also hear eclampsia. Are they the same thing or they are different?
No, they are different things. Preeclampsia, gives rise to eclampsia.
Mm.
Yep. Once a woman is having preeclampsia, that means there's this hypertension in pregnancy, there's this protein in urine,
Okay.
and then the other signs and symptoms of preeclampsia. But once she comes down with convulsion,
Okay.
it becomes eclampsia. So
Okay.
eclampsia is more like there's now a brain manifestation.
Okay.
So there are two different things.
Okay. So can I say that eclampsia is a more severe form of preeclampsia?
Well, I don't want to like put it that way because preeclampsia is also severe and serious. It's not something you should. Both of them, they are like an emergency.
Mm.
So to be like, I don't want to use that saying severe is eclampsia, non-severe is preeclampsia. Both of them are severe, but it just means that whatever you are doing for preeclampsia, you should like increase it for eclampsia because
Eclampsia.
eclampsia is like the one that you really do not have time again. It's like a very serious one.
Okay.
Yeah.
Okay.
Because once something affects the brain, you don't want to, because of how delicate the brain is, you don't want to joke with it.
Okay.
In preeclampsia, if it's a mild preeclampsia, you might still have time to manage the patient conservatively, like watching and then monitoring. But once eclampsia sets in, there's nothing like watching this patient. You must deliver that baby for that patient to be fine.
Okay.
Yeah.
Wow. 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 Thank you. Thank you. Thank you for schooling us today. So please, what are the symptoms of this preeclampsia?
Okay, aside from the two I've been mentioning, hypertension, which is an elevated blood pressure of 140 over 90 millimeter mercury and above, and then protein in urine, the other classical things you can see. This patient might come down complaining of persistent frontal headache.
Okay.
Then you can also have visual disturbances. A
Okay.
patient that was not having any issues with sight suddenly starts having issues with sight. And then you can have persistent epigastric pain.
Okay.
More like, okay, the person is now complaining, I'm having an abdominal pain and all that. Then sometimes you can see that this patient is having edema, usually bilateral epider edema.
Okay.
Then this patient too can also come down with rapid weight gain.
Okay.
Then also you can see this patient being breathless, coughing because of pulmonary edema. Yeah, so these are the signs are some of the signs and symptoms you can see in preeclampsia.
Preeclampsia.
Yeah.
Oh, okay, okay. So, you can hear from Dr. K. She is also an expecting mother. The signs, the things, the symptoms you should watch out for. So, whenever you experience any of these symptoms that she has mentioned, don't don't hesitate to consult your doctor or your healthcare provider. Thank you very much, Dr.
Welcome.
Okay. Let's move to the next question. So, what are the risk factors of this preeclampsia? What are the things that predisposes a pregnant woman from getting this preeclampsia?
Okay. Yeah, risk factors that once you have, you should be watchful of this complication, which is preeclampsia. First of all, a woman who is pregnant for the first time, that's a primary gravida.
Okay.
Then, even though she's not pregnant for the first time, but this is her first pregnancy with a new man.
Okay.
So let me say you have a woman who has been pregnant for a particular man for like 3 times,
Okay.
and then this her fourth pregnancy. She's now pregnant for a new person. She's at risk of preeclampsia. Or maybe you see a multi-parous woman that has taken like a 10-year gap
Okay.
since her last childbirth and now is pregnant again. She's also at risk. Or someone who had preeclampsia in her previous pregnancy is also at risk of preeclampsia in this current pregnancy. Then, unfortunately, as hypertension is more seen in black, preeclampsia too affects black people more. So, being a black, you're at risk.
Okay.
Then, when there's a family history of preeclampsia, usually first degree relative, let me say someone's mom, a woman is pregnant and her mom had preeclampsia during her time,
Okay.
or any of her sisters had preeclampsia, she's also at risk of preeclampsia in
The
her
genetics.
Yes.
Okay.
Then, if a patient is a known hypertensive and got pregnant, she's also at risk of preeclampsia in this her pregnancy.
Okay.
Then, a patient that is diabetic is also at risk. Then, for obese patients, usually BMI more than 35 and above.
Okay.
Then, advanced maternal age. If you say a woman that is 40 years and above pregnant, she should also be wary of this complication. Yeah, so those are the risk factors
Oh,
for preeclampsia.
okay, okay. Thank you so much. Thank you, thank you.
Welcome.
So how can this preeclampsia be prevented, or the chances of it occurring in pregnancy are reduced?
Okay. There are some things you can do to help reduce this incidence of preeclampsia. Although unfortunately, sometimes it doesn't really work out, but it's better you try it than you don't try it. First of all, you have to take your antenatal visits serious. So, because most of these things are diagnosed during antenatal, so how would you know if you are not compliant with your visit? So, regular antenatal checkup for those that are at risk, and then also for those that are at risk, the health practitioner, usually the doctor, can prescribe low dose aspirin,
Okay.
which is like an anticoagulant kind of, to help reduce this blood pressure and then help reduce some of the signs and symptoms that can predispose to preeclampsia.
Okay.
And then people that are at risk too, they can start up, the doctor can start up antepartum surveillance, fetal surveillance for the pregnant woman. That means you monitor the child inside the womb to know when there's a problem.
Okay.
Yeah, these are the things that you can help do to, like, okay, when there's a problem, you can be able to diagnose it easily and all that, and then also prevent the occurrence of preeclampsia.
Oh, okay, okay. Wow. Thank you very much. Thank you, thank you, and thank you again. So, Dr. K, what is the, like, yeah, on a general note? Do you have any advice you can give to the pregnant women out there?
Sure. First of all, I would like to say you are doing so well. It's not easy. to sacrifice
9
9 months
months. It's not
growing
nine
a
days. It's not
child
nine hours.
with all the stress, all the issues, all the pains,
Yeah.
the nausea, and all that. So keep
Yes.
up the good work.
Oh.
I mean, it's not easy, but I want to like plead. I noticed a lot of women are always nonchalant about their routine
Mm.
drugs. There's a reason why those drugs are there. It's not just for
Mm.
fun.
Yeah.
It's for you to have a healthy baby, for your body to also be healthy to carry the baby.
Yeah.
So you need to take those routine drugs serious. Yeah, you're vomiting, you're not able to tolerate the smell. You have to find a way to make sure that you're compliant with your routine drugs. Then secondly, don't joke with your antenatal visits. Most of these issues are diagnosed early only if you are compliant with your visits, antenatal visits. So you should always make your appointments no matter what. Then those that risk can be identified by the doctor and then treated and prevented, all those things prevented. Because at the end of the day, your aim is to have a healthy baby. And then also your mode of delivery. Please and please, mothers, cesarean section is not a death sentence. If your doctor decides that the best method for you to deliver is through cesarean section, please understand and then go on with it. You see a lot of women dying or their baby dying because they said they must deliver like the Hebrew women.
Women.
There's no bad form of
It's very
delivery.
common.
Like I said, the aim is to have a healthy baby and a the mother coming out alive.
Alive.
So whichever your health practitioner, your doctor knows best. If he decides that your best form of delivery is cesarean section, please do not argue or do not keep waiting to deliver like the Hebrew women. Go on with it and carry your child and go home peacefully. So that is that for now. Keep up the good work. And at the end of the day, I pray you have a successful pregnancy journey.
Amen. Amen to that. Wow, wow, wow. Thank you for accepting to be on for Siscap TV today,
You're
Dr. K.
welcome. I'm happy to be here.
Thank you so much. Okay. I remain for Siscap and
Dr. K.
oh, thank you. Please like, comment, share this video. Remember to follow Pharmacist Cav on Facebook, Instagram, TikTok, and subscribe to our YouTube channel. Thank you and have a great day.